Hi students, so in today's session we are going to address the competency 3.1 and 3.2. So the topic for today's discussion is amyloidosis. So the specific learning objectives that I am going to cover today are definition of amyloidosis, discussing the properties of amyloid proteins, describe the pathogenesis of amyloidosis, classify amyloidosis and describe the morphology of amyloid in various organs. So what is amyloidosis? Amyloidosis is a condition associated with a number of inherited and inflammatory disorders in which the extracellular deposits of fibrillar proteins are responsible for tissue damage and functional compromise. So there is extracellular deposition of fibrillar proteins and it is responsible for damage and functional compromise of the organs where it is being deposited. So there are various properties of amyloid, characteristically the physical and chemical properties of amyloid. So what are the physical nature of the amyloid? Electron microscopically we can view non-branching fibrils of indefinite length, approximately 7.5 to 10 nanometer in diameter. So this is the electron microscopic view of amyloid. X-ray crystallography and infrared spectroscopy shows cross beta plated sheet conformation. So this is the X-ray crystallography and infrared spectroscopy view. And in hematoxylin and eosin stain we can see amorphous eosinophilic extracellular substance. So in this picture we can see this is a glomeruli and in between the glomerular capillaries or the this thing we can see the amorphous eosinophilic substance being deposited. So chemical nature of amyloid, 15 biochemically distinct form of amyloid protein have been identified and the most common one are AL amyloid light chain, AA amyloid associated, A beta and others are transthyretin and A beta 2 microglobulin and prion proteins. So AL amyloid light chain, A is amyloid associated, A beta and the others include transthyretin, beta 2 microglobulin and prion proteins. So coming to AL amyloid light chain, derived from plasma cells, it is a complete immunoglobulin light chain and it is usually composed of lambda light chain but kappa chains can also occur. Deposition is related with some form of monoclonal B cell proliferation like multiple myeloma. Coming to AA amyloid associated, it is a unique non-immunoglobulin synthesized by the liver and it is derived from precursor serum amyloid associated protein and it is increased in inflammation as a part of acute phase response, also called as secondary amyloidosis. Coming to A beta, A beta is found in the cerebral plaques and blood vessels in Alzheimer's disease and it is derived from a larger glycoprotein amyloid precursor protein. Transthyretin, it is a carrier of thyroxine and retinol. It is the mutant form is deposited in familial amyloidotic polyneuropathy. Normal form is deposited in senile systemic amyloidosis. It is beta 2 microglobulin. It is a component of major histocompatibility complex class 1 molecules and normal serum protein and it is seen in patients on long term hemodialysis. Pathogenesis of amyloid. Normally the proteins that are abnormally folded should be removed from the body in as two mechanisms. Normal proteins which fold improperly when produced in increased amounts and mutant proteins that are prone to misfolding. Pathogenesis of amyloid. The normally misfolded proteins are degraded intracellularly in proteasomes and extracellularly by macrophages. In amyloidosis, these quality control mechanisms fail and such proteins are deposited in the extracellular space. So, we can now see the morphology of different organs in amyloidosis. So, affected organs are enlarged, firm and waxy, and the major organs that are involved include kidney, spleen, liver, heart, tongue, and other organs include adrenals, thyroid, pituitary and nerves. Kidney is normal or shrunken, it can be pale or waxy, and you can see in this picture the pale and waxy cut section of the kidney. Microscopy, it is first deposited in the glomeruli. We can see the glomeruli with amorphous eosinophilic deposits. Later in the interstitium and in the arteries. Finally in the obsolescent glomerulus. You can see amyloid deposition here, and in this picture also we can see the amorphous eosinophilic substance being deposited. So, this is the apple green birefringence that we see on polarizing microscopy. Spleen is moderate to markedly enlarged. When limited to the white pulp or the follicles, it is called as a sago spleen. When in the red pulp, it produces large map-like area of deposition called as the lardaceous spleen. So, this is the picture depicting a lardaceous spleen, and these are the sago grains that we use in our cooking, and you can see it is exactly similar to the sago spleen that we describe in amyloidosis. So, this is a picture of a lardaceous spleen. So, in the liver, it is inapparent or it can cause hepatomegaly. So, you can see the widespread area of deposits of amyloid in the liver. First in the space of Deci, and it is replaced by large areas of liver parenchyma. In the heart, there is no changes, or the heart will be enlarged and firm. So, microscopically we can see subendocardial deposits, or it will be deposited between the muscles. So, you can see the deposition of amyloid in between the muscle bundles. And staining characteristics of amyloid, the most important one is Congo red stain and polarized light. So, for amyloid of all types, we can use this Congo red stain and polarized microscopy. So, used on both gross and microscopy. So, you can see the hematoxylin and eosin Congo red staining depicting Congo red staining, and it is pink red in color, and stain sections on polarizing microscopy shows the characteristic apple green birefringence. So, summarizing, we have got amorphous eosinophilic substance being deposited in between the extracellularly, and it is classified as AL, AA, A beta, beta 2 microglobulin, prion proteins, etc. Okay. So, and we have seen the morphology of different organs with deposition of amyloid, and we have seen the characteristic Congo red staining and apple green birefringence on polarizing microscopy. So, that is all for today's class. Have a nice day.